This Muslim surgeon saved millions of lives, but nobody knows him. His name was changed to Al-Bukasis. Do you know why? Picture a surgical patient in 9th century Europe. The operation is over. The wound is closed. The surgeon has done everything right. And now, days or weeks later, the patient must return because the stitches have to come out. Another incision, another procedure, another opportunity for infection to enter a body that is already weakened and healing. For centuries, this was simply accepted as the way surgery worked. You survived the first operation and then faced the second. The removal of sutures was as dangerous as the placement of them, and for patients who had barely survived the first procedure, the second was often fatal. Al-Zahrawi looked at that reality and refused to accept it. His name was Abu al-Qasim al-Zahrawi, born in Cordoba, Islamic Spain in 936 AD, a surgeon so far ahead of his time that the instruments he invented are still sitting in operating rooms today, over 200 of them, unchanged in principle after 1,000 years. A man who didn't just perform surgery, he systematically reimagined what surgery could be. He began experimenting with material, testing what the human body would accept, reject, absorb, or dissolve. And in the intestines of sheep, processed and dried into fine thread, he found something nobody had ever noticed before. The body didn't fight it, it absorbed it, incorporated it into the healing tissue, and then, quietly, over days and weeks, dissolved it completely. The stitch disappeared inside the body once its job was done. No second operation, no removal, no additional risk. The wound closed, the suture vanished. The patient healed once and was finished. He documented the discovery in Al-Tazrif, 30 volumes, the most comprehensive surgical manual the world had ever produced, translated into Latin, taught across Europe for 500 years. The foundation that Western surgery was built on, written entirely by a Muslim physician in 10th century Islamic Spain. Hit the follow button. We need your support in this journey.